Now, we are going to discuss going through the holiday seasons without gaining 10% of our body weight. So that would be 18 pounds for me, right? So not really, but our patients who are going through the program, they may be struggling with this the most. We want to make sure that we give them some guidelines and support them as much as we can from our side, so that they can actually have a good maybe preparation, understanding of what's happening and what needs to happen. So we have our 3 patients who are going through the program. They will still have they still have some time to get to the surgery, but the time that they're most struggling right now is between Thanksgiving and Christmas and New Year. Food everywhere. We have access to food, office, home, wherever you go, there are cookies, chocolates, drinks, and this is already a struggle for many of us, and we are also struggling with this personally. But if I were to go through, if I was at BMI 47, how would I actually deal with this, right? So this is a little bit more difficult time. So, and I was hoping that Dr. Erkan would actually give us some guidelines and some guidance so that we can actually help our patients to go through this process.
Absolutely, absolutely. This is obviously good timing for us to talk about this, Kemal. So although bariatric surgery is really the most effective treatment we have for morbid obesity right now, morbid obesity being defined as obesity which is out of control, people who are at least 100 pounds over their ideal body weight, or who have a body mass index greater than 40 or sometimes even greater than 35. Definitely bariatric surgery is the best treatment we have available right now. Having said that, even with bariatric surgery, patients can still struggle with weight regain, because as we've said many times in this session, obesity really is a biological problem primarily. And even surgery does not fix the biology, essentially. The biology, which is the tendency for the body to prefer a higher weight, will still be there. So if we allow it, if we let go, essentially the weight could creep back up. And holidays is one of the danger times from that point of view. It's interesting, Kemal, that when we talk about holidays, all of us really goes through the same issue, right? We pick up a few pounds and then we have to go back and try to lose them. And one of the best things you hear from patients very often is, hey, for the first time, I lost weight during a holiday, after they've had surgery, just particularly early on. Having said that, we talk about the danger of, letting go. Clearly, holidays are a time of celebration, as you mentioned. It's a time for us to gather with family, with friends, and obviously, culturally, one of the important focus of celebration is food. So there will be a lot of food, and not all the food is healthy, as we know, right? So we have to be prepared mentally, and we have to give some kind of hints and some kind of suggestions really for patients to try to avoid falling into that trap. So the first and most important thing, I believe, Kemal, is to be aware that weight gain could happen during the holidays. So if you prepare yourself with that mindset, I think you are already ahead of the game. You're not being caught by surprise, essentially. So there are going to be many parties, there are going to be many gatherings where there will be a lot of food. So how do I prepare myself? How do I, first of all, think about when I go there? Well, there are a few things that you could do. For instance, avoid going hungry, right? If you haven't had any food and you're going suddenly into this party where you're going to be distracted with social mingling and talking and other things, then you may not be aware how much you might be eating at that time. So you have to avoid going hungry. That's really important. So try to eat something before you go, right? And then another thing is, take a friend with you that can hold you accountable. Somebody can watch out for you and say, hey, we are going to watch out for each other. We're going to try to stay disciplined. And that kind of preparation may help as well, right? And sometimes, particularly when you are going to a gathering where people are bringing their own food, you should bring the foods that are going to be most helpful to you with you, not the foods that you struggle with, right? So bring healthy stuff, healthy snacks, which is mainly vegetables and proteins, so that you can focus on those when you are, when you're eating with others. So those are preparation mindsets that could set you really for not failing when you are going to those parties, essentially. And then, of course, we can talk, what do you do when you are at the party? What kind of strategies can you use to minimize being caught in a situation where you're overeating?
So let's actually, let's put it in perspective so that people can actually follow. So when we go through this process, and we are not just talking about our patients only. This applies to all of us. And perhaps I repeated this in the other sessions for the same topic before, but because holidays are happening every year, so maybe we should actually go every 3 years, so then we don't have to deal with it every year. So maybe not, but last Friday was our holiday party for United Medical and CHRIAS Surgery Center and United Medical Clinic.
It was a fantastic party, by the way, Kemal.
It was.
Really well done. And kudos to the people who really prepared and organized it. And it's probably one of the best Christmas parties I've ever been, to tell you the truth.
Well, and we'll be very happy to hear that. And there were a couple other people helping, but it was mainly that was her show. So, and I really do appreciate that. But we knew that we were going to have drinks and food in this place. So the party starts at 7. So one of the habits that I started having since this COVID weight gain, actually, I'm still struggling, but personally, like I still didn't lose this extra 20-25 pounds that I gained. And I'm more careful around these times. So I knew that I was going to eat more than what I would. So then I start preparation earlier mentally. But then one of the things that helped me the most is having like egg whites. So because if you're going to have a couple of drinks, you don't want to be empty stomach. So then the egg whites are, I had 3 of them, and it held me up for the whole day, all night. Now, can our patients who are going through the program, would that be enough? Would that hold them up as much as it would hold me up?
Oh, absolutely. Absolutely. In fact, it may hold them up even better, Kemal, because remember, our patients do have a much lower volume of stomach, regardless of what procedure they've had, whether they've had the sleeve gastrectomy or the gastric bypass, or even if they're band patients. Remember, the stomach that receives the food volume-wise is a lot smaller than the original stomach. So, in fact, that may be one of the questions people would have and say, well, how can you overeat if you've had bariatric surgery? Well, essentially, the issue is not really eating a lot of volume at once. It's eating small amounts frequently, right? And also choosing foods, perhaps, that have more calorie per volume than other foods, right? Mm-hmm. Those would be the sweets, for instance, right? That would be a major issue, right? If you're eating a lot of sweets or a lot of carbs, as opposed to eating vegetables, as opposed to eating protein, where potentially the calorie amount is small per volume, essentially, right? So yes, absolutely. The preparations that you're suggesting would work very well, because you are going to a place where you are still going to enjoy the company of others, but then you are not going to be struggling, essentially. But what other things can they do, Kemal? Okay, well, for instance, remember with, for instance, the setup we had for the party, there were stands where people had, access to a lot of food, right, for the buffet, right? So if you are going to be hanging around those tables most of the night, you are more likely to be picking from that food, right? So what you could do consciously is stay away, stay in a corner of the room, for instance, where there is no food near you, right? Because if you're gathering around and you're standing and talking with people and then the food is right by you, then the temptation for you to pick from that food is much higher. So consciously understand the positioning of the room and stay in an area where you are less likely to do that. So that's one small thing, right? Another thing that you could do, obviously, is when you are going for the foods, instead of following the pattern that they have laid out for you, where you're going to take out most of the stuff, you could selectively fill up your plate with things that have less calorie first. So your plate physically does not have any more room for the things that you don't want to have, like the carbs, for instance, or the sweets later on, right? And then the other major, obviously, issue that we have talked about, but we obviously have to mention here is alcohol, right? And alcohol, we had a full session in the past about, what is our stand on alcohol, right? And we talk about the fact that alcohol is empty calorie, alcohol increases appetite, right? And so there is a danger with alcohol as well. And of course, the other big thing with alcohol is that, if you've had bariatric surgery, it takes much less alcohol for you to become drunk than otherwise, right? And then if you are drunk, you are less likely to be focused on what you should be doing. So the alcohol situation actually can worsen, right? Now, that mean you cannot have alcohol? No, it just means that you have to be careful. And then if you are going to have alcohol, avoid the mixed drinks, the ones that are likely to have a lot of soda, fruit juice, and other things that will have a lot of calories. So all these are preparations that people can do, Kemal, to minimize the risk of being overindulgent at during the holidays and therefore gain weight.
Now, I think maybe just to kind of separate the patients who already have bariatric surgery versus patients who are going through the process to get the surgery. Well, our patients who have gastric sleeve or gastric bypass, if they already have this, they're going to be already kind of prepare for these types of things because they're going to be less hungry anyway. So I think it's a little bit easier for them in a way that at least the hunger won't be there as much versus patients who aren't going through the process. We don't want them to gain weight. So some of them, they're already kind of delaying the process because of the either right before Thanksgiving or right before Christmas or right before New Year. So they already kind of delayed. Now they have a little bit longer time to get to the surgery. So I want to kind of maybe kind of focus on those patients who are not done with their surgery, who are going through the process. So because they now have the problem of hunger, right? So we have some bad habits to get there. Like not all of them are about the habits, but that's already there. So like if my stomach is going to tell me that I'm hungry or more hungrier, then I'm going to be struggling when I have food all over the place. So that's why I was thinking that for those patients, is there like some small meal before you go to the party? Would that be like the most ideal? What do you think?
Absolutely. I mean, all those are strategies that are good. They will work for both, right? It's all about the preparation, right? But more importantly, even Kemal, the patients that are preparing for surgery, we do not want to be in a situation where, people are going to be relaxed because they're going to have surgery anyway, right? I do remember many years ago, a young gal came to our office. I think she was about 20. She came with her mom and for surgery, right? And she definitely was a candidate for surgery. And as we were preparing and talking, she showed up a few months later. This was before the time we had the focused case conferences like we are having right now. And she had gained 60 pounds. I was shocked. I said, what happened? Well, her answer was, I'm going to have surgery anyway, right? So that was her mindset, right? So it's very important as we educate our patients to make sure they understand that, gaining weight through the process actually is sometimes that could hurt their chances of getting authorization from the insurance companies because many insurance companies actually penalize patients for gaining weight. Now, we as a program, obviously, we're not there to penalize, right? But also we want our patients to start having a lifestyle really that will be implemented even before surgery, and it will be the chance for them to really implement that lifestyle is higher if they start even before the surgery to think this way, right? So I'm going through bariatric surgery right now. I am preparing. There is a holiday party. Should I be careful? Of course, you have to be careful. And what would be the things I need to do? And obviously, we're talking about them, right? So that avoid going hungry, have a friend that can hold you accountable, and you may hold them accountable as well. And then all these little strategies that we're talking about being conscious of the fact that the setup in a holiday party is there for you to overeat. And then obviously, we don't want that to happen. And the whole reason we're talking about that essentially is because holidays are about food, right? Particularly the way we celebrate them, right? And it's not only by going to a Christmas party like the one you and I went to, the fantastic party we had, but it's also, in the office, in any communal gathering, in the neighborhood. It's all about getting together, reconnecting with friends and families. And what is the central theme in all these reconnections is the food. So we all gather around the food, right? Well, it's good. We're celebrating. We're offering to friends and they're offering to us. But obviously, when we eat too much, then that becomes a health hazard. And that's why we're here, right? We're talking about obesity, and the primary driver of that is because we're eating too much. And there are a number of reasons why this is happening, because the biological drive that we have also is that our body, instead of using the energy source that we have, even when we have excessive energy, we are still hungry. But sometimes there is, mental hunger as well that we don't talk about, Kemal, right? Sometimes we are full, and yet we have this compelling reason for us to eat. We have to recognize these situations, because if we don't, then obviously we're going to fall into the trap.
So I think as you discussed in some of our other events, the celebration and getting together and celebration is the focus, where the food is the centerpiece, and we are trying to please each other with food. These are all, part of the issues. And I was thinking that, and we use this for our diabetes program too.
On the other hand, smoking, you would think we shouldn't even be discussing this, right? Smoking should be banned, because the plethora of problems that are associated with smoking in our health have been so well established by now, right? And yet, of course, a lot of people still struggle with tobacco addiction, and a lot of people do smoke. And it's important for us to address that issue, not only in terms of the general health of the person, but also because there are some very, very pertinent issues related to smoking and bariatric surgery. So this session today is obviously very important. Let me start with smoking first, right? As I said, my answer would be no one should be smoking, right? Are you preparing for surgery? You should stop smoking. Why? Not only the general problems of smoking, but surgery, going under anesthesia, and as a smoker, having smoked cigarettes, the day before surgery, you're actually increasing the risk of complications of that surgery tremendously, right? The risks of anesthesia itself, the risks to the surgery itself are very, very high. So most surgeons, where they are preparing patients for elective surgery, which is surgery that is planned ahead of time, will really counsel their patients to stop smoking. When you are undergoing general anesthesia, it means that the control of your breathing, the control of many of the other systems within your body is actually going to be taken over by the anesthesiologist. The person will be asleep, right? Will not be feeling anything at all, right? So breathing particularly is something that the anesthesiologist will take over. They will have to put a breathing tube down the person's windpipe, and then there's a machine, a ventilator, which takes over the action of breathing. In a person who is a smoker, the lungs, the respiratory system is already at a huge disadvantage. So for a person to recover from that situation where a machine were making them breathing, really, it's going to be very difficult. For some patients, it may be so difficult that it may be very hard for them to come off the ventilator after the surgery. Other patients will have a hard time recovering from a respiratory point of view, and they will be at high risk for developing pneumonia, and people can die with a pneumonia after surgery. So the risks of surgery and smoking are very, very real. Not to mention the issues related to healing, right? When we are smokers, our ability to heal, to supply blood to the areas where our body needs it most, where it has to do the actual process of healing, is interfered with. So we may be at risk for infection. We may be at risk of wound disruption, right? So all those problems are real and they are related to smoking. So definitely we want our patients to stop smoking before major surgery.
Well,
but
so
go ahead.
Can we just pause a little bit? Again, for average person to understand this, like, can you just maybe, even if you did already say, maybe say it in a different way so then everyone can understand what happens when we smoke?
Absolutely. So when we are smoking, Kemal, we are inhaling poison to our tissues, right? That actually, because the smoking is done by inhaling things, so it's our respiratory system which is directly affected first, that gets the most of the damage is in our respiratory system. So the windpipes, all those little pipes that start from our windpipe in our throat and go branching into our lungs, all those little pipes will be damaged. They will be super reactive. And then the actual lung tissue, which is extremely delicate, very, very delicate, because it has to be able to support the exchange of gases between our blood and our windpipes. That tissue of the lungs gets damaged very, very easily. And obviously smoking, and we're talking about habitual smoking here, people who smoke on a daily basis, right, are really damaging their tissue on and off, right? The good thing, Kemal, is that the most amazing thing is that the ability for our tissues to recover is extraordinary. So if a person actually stops smoking, that damage not only stops, but our body is able to heal very quickly, so that a person who stops smoking for 4 weeks, for 6 weeks before surgery, they will be really in way much a better shape than they were, before they stopped smoking from that point of view. And as we know, even the other damages of long-term smoking, the longer a patient has been since they've stopped smoking, the more likely it is that the person will get out from that danger. Even the danger of getting lung cancer actually can disappear over the years once a person stops smoking. So smoking directly damages our respiratory system, but obviously there are other damages that occur in the rest of our body as well.
So now, for those maybe who may be a smoker and they stopped smoking 4 months ago versus they stopped smoking 2 weeks before the surgery, so what's our approach on that case? So
again, the most important thing would be to stop for our practice. As you know, we say a month. They have to. If the patient is still smoking within that month, before surgery, we actually delay the surgery. We postpone it. It's very important for us. And I'm talking about somebody who continues to smoke on a daily basis here, right? And why is that? Well, we are talking about the fact that if there has been that 1 month, 6 weeks interval, the chances for recovery of their lungs and the rest of our tissues is going to be much higher, as opposed to the person who just stopped smoking a few days before surgery. So for bariatric surgery, we definitely have this stop. Now, why is it, let's go delve a little bit into bariatric surgery specifically here, Kemal, right? if a person resumes smoking after bariatric surgery, there is a huge danger of them having complications related to bariatric surgery, particularly with something like gastric bypass. When we do gastric bypass, Kemal, we actually create an artificial connection between the intestine and the stomach. That artificial connection heals by creating a scar, right? That connection itself is vulnerable to damage to that scar, to that connection in the form of an ulcer. An ulcer is like an open wound, essentially. And that potential is a lot higher for somebody who's a smoker than a person who doesn't smoke. And when people develop ulcers after gastric bypass, first of all, their life is miserable because they will have pain continuously. They will have a lot of pain every time they eat or drink something, right? So there is that quality of life. But more importantly, Kemal, with ongoing smoking, that ulcer will not heal no matter how much medication we throw at them, right? And there are complications of ulcers. Ulcers can burst. If an ulcer bursts, Kemal, unless surgery is undertaken emergently, that person can die. Or an ulcer can bleed, and the bleeding can be so rapid and so massive that a person can die of exsanguination in that case, right? So there are real life-threatening problems associated with ulcers after gastric bypass, for instance. And those risks are so much higher with smoking that it is critically important that anybody who's contemplating to have gastric bypass or they've had gastric bypass, they completely refrain from smoking, right? So if a person was a smoker, Kemal, and they've stopped smoking before a bariatric surgery, it is critically important that they stay quit afterwards. Because as we know also, Kemal, tobacco is very addictive. So there is no such thing as, oh, I used to be a smoker, I feel like having a cigarette now. The minute they have that cigarette, the chances for them going back to the habit again are much higher. So it's important that there is total and complete abstention from smoking after bariatric surgery.
Exactly. So there are times that I'm wondering like how much of this is understood by patients. And you know, I can tell probably 25 to 30% of patients that are still smokers. So like when they start the process, and then you know the medical marijuana is also very common. Not medical is very common. Sometimes smoking is understood in a different way. So, you know, kind of the way that Bill Clinton answers questions. So, the definition of smoking is just a cigarette, or is it like, can I have other stuff? So, how is that limited with the? And I'm not trying to be advocate for anyone, so I'm just asking. So, can they have like medical marijuana like during that time, or is it the same?
So there is a differentiation. Definitely tobacco, nicotine, the problems I have mentioned are much better documented and known to us, right? Now, there is evidence now that inhaled marijuana could also cause ulceration and irritation to that connection that I talked about, although the data is not as strong as we have it for nicotine, right? There are patients who are not just from a recreational point of view, but medically prescribed, they take marijuana. So if they have to do that, my preference is for them to have edible medical marijuana as opposed to inhaled, because the problem is a lot larger when they are smokers as opposed to taking edible marijuana.
And then we are not suggesting that anyone should be doing it, but if they do, they should know what's expected. Now, let's go back to the alcohol.
Yeah, absolutely.
So moderation is something that is kind of like subjective, I guess. So moderation to you versus me may be different. What is that? And while you're actually explaining that, I'm going to just go there and get it. And don't ask me why I have a wine glass in my office, but I do. So I'm just going to get that and then just show it to people.
Absolutely, absolutely. So clearly, alcohol, right? In moderation, okay, we're fine, right? But when we are faced with excessive habitual drinking, that's where the damage can come as well, right? And there are certain specifics that are pertinent to bariatric surgery. First of all, let's start before surgery, right? Before surgery, people ask, can I drink? When should I stop? I tell people, look, stop about 2 weeks before the surgery, right? Even, moderate drinking. And the risk here is, we don't want there to be interaction with medication, interaction with the medication that we will give them at the time of the surgery, because there could be interactions depending on when they have, they drink alcohol. So the best policy would be to say, okay, stop a couple of weeks before, and that's at essentially. Now we're talking about people who drink socially, moderately here. We're not talking about people who consume alcohol in excess, right?
Let's do the moderation, and it's water.
Yeah.
So
yeah.
this is
So
one glass, right?
So one glass, you're going to pour about what, 6 ounces, maybe at the most 8 ounces.
Am I at moderation yet?
Yeah. So you will. that sounds like a 12 ounce right now, right?
So it's more than moderation, right?
That's way more than the moderation, of course. Yeah,
okay.
yeah.
So,
and then we will touch up of the fact that, when it comes to life after bariatric surgery, moderation is even a lot smaller than that, because the effect of alcohol, as we will talk shortly, is a lot stronger, after bariatric surgery than before bariatric surgery, right? So
about now, are we?
Yeah, I think I can see that. That's actually like a reasonable portion, right? Like that's the normal 6 to 8 ounce
when you go to a bar, if you ask for a glass of wine, if they give you this much, you would probably fight. So that's what we are trying to say. This moderation is really 6 ounces, right? So we are talking about, and this is maybe that. But normally when you go, you are expecting this. This is at least 3 times more than moderate.
Yeah, so we should be drinking water in that amount, not alcohol, right? So absolutely. So that's very important to understand, obviously, right? So we've talked about before surgery, stop 2 weeks before. And again, we're talking about people who drink socially and moderately. Now, if somebody has been identified as having an alcohol problem, in other words, somebody who's really drinking heavily on a nightly basis, heavy drinker on weekend, and so forth, it's very important that that issue is addressed before surgery, because in that case, we are bordering towards having a person who is struggling with alcoholism, and that has to be clearly understood, and that person needs to seek treatment, because the chances of them going back to heavy drinking after bariatric surgery are very high. They are in danger of going to that zone. And becoming a heavy drinker after bariatric surgery is a whole world of huge problems that, that are way worse than a person that hasn't had bariatric surgery. And I will explain that in a minute, essentially. After bariatric surgery, even for moderate drinking, I tell people to wait 6 months, right? And that will give time for all the changes to occur within their physiology, that their GI tract is well healed. And then after that, they can introduce moderate drinking. We are talking about morbid obesity today, and the fact that we are addressing comorbidity really goes to the heart of our current definition of obesity, right? Obesity is no longer an appearance issue, an issue of, how I look, or what kind of clothes am I going to wear. It goes way beyond that. It is actually a medical condition. And it's a medical condition not just by itself, but it's actually connected to many other illnesses that pop up once a person reaches a certain weight. And as we've said many times, what is obesity? What is morbid obesity? Well, it is defined by the weight of the person. If the weight of the person really goes up by about 100 pounds over their ideal body weight, that person's weight now has reached the level of morbid obesity or clinically severe obesity. And as we've said before, sometimes as healthcare workers, we define this by BMI or body mass index, which many people may be familiar with. And BMI really is another expression of the severity of the weight, because what we do is we take the weight of the person and the height of the person, and we have a formula that puts these two together to give us a BMI, the body mass index. So we know, for instance, there is a normal body mass index associated with a healthy weight that happens to be anywhere between 18 to 25. So if your doctor calculates your body mass index and say, hey, your body mass index is 24, it means you have a very healthy weight, right? On the other hand, if the body mass index goes up between 25 and 30, we talk about the person being overweight. If it's 30 to 35, we talk about the patient having class 1 obesity. If it goes between 35 to 40 now, we talk about class 2 obesity. And then when it's over 40, then obviously it's the most severe type of obesity. We call that morbid obesity. And as it happens, morbid obesity is also the level of obesity that qualifies a person to have surgery to address obesity with a surgical treatment.
So the most common morbid obesity, comorbidities for morbid obesity is hypertension, heart disease, diabetes, sleep apnea.
Yes.
But these can happen without morbid obesity as well.
Absolutely.
Makes it like which starts first in these cases?
So, of course, you can have a person who is very thin and they have diabetes. Of course, you can have a person who's very thin and they have heart disease or hypertension. And very often these are related to genetic factors more than anything else. But when we take heart disease, high blood pressure, diabetes, currently in our population, in our society, it is by far the type of disease related to morbid obesity, right? And how do we know that, Kemal? We know that because there has been a parallel increase of obesity and the prevalence of these diseases in our society, right? So if you go back to the 1960s and 1970s, the level of obesity in the United States, Kemal, was about 10%, 10 to 12%. If you go everywhere in the United States, people with a body mass index greater than 30 would be about 10 to 12%. Now it is 35%. And along with that increase in the incidence of obesity, we've also seen an explosion in the incidence of high blood pressure, cardiovascular disease, and diabetes. So yes, of course, you can have those diseases without obesity, but the type of those diseases we have currently in our society by far are related to obesity. That's why addressing obesity makes a lot more sense than us chasing each disease on its own, because it's inefficient, it's very costly, right? And the results are not as good. Why not address head on the root cause, which is obesity currently in our society?
What we find in our daily case conferences, when patients start, they don't even sometimes know that they have these conditions.
True.
So how many times we diagnose people with diabetes because their A1C is like out of control. They have sleep apnea, and then they think that they're just snoring, but no, they do have sleep apnea. And then we have so many patients, we actually diagnose them at the time of after the initial consult. So the awareness of these issues, like do our patients know that they have these conditions, or do they get used to having them so that they don't actually feel the issue anymore? Because if they didn't come for this bariatric surgery consult, they wouldn't maybe find out for these issues for a long time.
Absolutely, absolutely. If appropriate tests are not done, very often patients will find out that they have these conditions when those conditions have reached an extreme level of severity, right? So it is not uncommon for patients to present with a stroke as a consequence of high blood pressure that has been going on for too long and has reached severity now. Because as you know, blood pressure, high blood pressure does not give you any symptoms unless you measure it. You do not know that you have high blood pressure. But then when the high blood pressure has been going on for so long and it's severe, it could suddenly give you a stroke that could give you debilitated, right? So those diseases sneak upon patients in a very, very, very dangerous way. But also, Kemal, if you think about it, obesity itself also sneaks upon people in that way, right? How common is it for a person to look at themselves in the mirror every day and not realize that their weight has reached very high levels? Very often, they kind of lull themselves into thinking, yes, they've gained weight, but it's not that severe, right? And then symptoms start appearing, right? Somebody may have struggled a little bit with weight and they've doubled with some diets, but then over time, the weight actually, you know, whether it's 5 pounds or 10 pounds every 1 to 2 years, it accumulates to levels that are very high. And perhaps their first presentation to their doctor may be, oh, I have knee pain now when I walk, or I cannot breathe well when I'm going upstairs, right? So the doctors will see them and maybe they have postponed this for a long time, and maybe their blood pressure is being measured for the first time then. And then bingo, the blood pressure is skyrocketed, right? And the doctor may do blood tests at that time and find that their A1C is also very high. Now they have type 2 diabetes, right? And the doctor may ask them about their sleeping patterns, and they may say, look, it's been that I don't sleep very well. I fall asleep during the day. I take naps very often. And my partner tells me that I snore like there is no tomorrow. And they do tests, and suddenly now we find that they have sleep apnea. And at that time of evaluation of their high blood pressure, Kemal, they may have an echocardiogram, and the echocardiogram suddenly may show that there is weakness of some of the chambers of their heart because heart disease has also developed, right? So suddenly a person who may be middle-aged, who thought of themselves very healthy, except the fact that they have a little bit of weight, suddenly they find themselves confronted with the fact that they have to take so many medications and they have to go to so many specialists, right? And what is the key here? The key is that the weight has crept up on them. And then the other interesting thing, Kemal, and this is also very human and natural, is that people are afraid to weigh themselves because they kind of are worried to find out where they are.
No, I'm one of those people.
Well, we all are, right? Come on, to some extent, right? Because we don't want to see that scale, right? And then when they see, and then their doctor will say, look, you actually have morbid obesity. You may be a candidate for surgery. And they say, what are you talking about? Surgery for me for weight? Because they associate bariatric surgery only with, you know, my 600-pound show, you know, that show where there are people who really are extremely obese and they undergo surgery. And yet they are actually the ones who may benefit now because they've crossed that threshold of obesity where now they have developed all these illnesses. And then the more you talk to them, actually, the more you find that there are many other illnesses. They may have migraines. They may be feeling depressed because of the way they feel and the fact that they don't have energy and the fact that the weight may be affecting their relationship now, right? They may have heartburn. They may have fatty liver disease, right? They may have gout. They may have other joint problems, back pain, all a constellation of symptoms come out that are all related to obesity.
So I'm going to share my screen for a second. And normally, you know, we kind of shy away from that, but just for this purpose, because I want this image to be understood very well. When we talk about resolutions of comorbidities, we are not talking about like some issue being maybe resolved, maybe not. The percentage of the resolution is extremely high. And so this is what I wanted to share with our audience so they can kind of actually see this. Now, when we look at, and I'm going to actually, 1 second, so where's my, all right, so I'm going to use this guy here. All right. So when we look at type 2 diabetes, so this percentage is 83%. of the time, this is going to be resolved. So that's extremely high. So then I go to like sleep apnea, and 74 to 98% range, this issue will be resolved. So then we look at the cardiovascular, the third common one is 82%, and the hypertension is between 52 to 92%.